As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission, I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain, keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
I'm trying to grow up.
We have to go live. Harry, we're ready to go?
We're live. You guys were stepping on the song and me.
Well, should I wait for
No, go ahead. I already announced you.
Oh, you already announced, and you did such a great job. Actually, you've been doing such. What has it been? 3.5 years, Harry? How long have you been station master?
I don't know. Since Donald Trump.
Since Donald Trump. Okay, well, that's one way to look at history and her story, and hopefully we'll have other benchmarks to kind of recall next the upcoming election. That's kind of a side, guys, because for WNHH, there's so much that people can listen to in terms of my show. Here on Mondays, Harry has a show. Kind of look at the WNHH website and 103.5. Go to Facebook and New Haven Independent. Because the variety of hosts and the variety of topics are really, I think, insightful for people to get a complete feel, if not complete, a very extensive feel of what's going on in the New Haven area, but also in the world and also in the state, for that matter. Yeah.
Oh.
Headsets will help a little bit. It's kind of optional. Mm-hmm. But today's show is Community Caring in Action. Community Caring in Action. And I chose that theme because Lane Janakis, all right, Janakis is here with us, and Whitney Allen. And these are two folks that really, in my mind, exemplify what does community caring and action mean? What is it? How do we epitomize it? How do we actuate it? How do we become an example of community caring and action, regardless of your daily walk? These two gentlemen and ladies, Lane and Whitney, have really roles and actions and responsibilities that really, as I say, illustrate community caring and action. And Lane is the transgender care case manager at Anchor Health Initiative. And Whitney I met a few months ago, Whitney, for the
I feel like it's been longer than that.
But a lifetime of experience is kind of condensed into 9 months. But Whitney actually has her Master's of Public Health. And do you have your undergraduate degree, by the way?
Yeah, Bachelor of Arts.
Bachelor of Arts in
psychology.
In psychology,
yeah.
And Whitney has her Master's of Public Health here from Yale, I believe.
No, Southern.
From Southern.
Shout out to Southern.
Shout out to Southern. The Owls. Let's hear it for the Owls. I mean, this is an academic community, absolutely. And research assistant for the advocacy, relationship, and community health kind of initiative at the Yale School of Public Health. But both Whitney and Lane are here to really help us to kind of understand what does community caring and action mean. And I want to, this may sound like a challenging question, but your role, your impact at your organization, some people just think that, I'm just there to get a job or just there to just get money or get my 401k, or if people have 401ks. But you two kind of have convinced me, we had a lot of dialogue before, that your role and your impact at your organization is really important. And it's important to me. And I think it's important for our listeners to kind of hear role and impact at your organization. Whitney, might you want to start on that thing?
Sure, I'll dive into pretty much what I do. So right now I'm the research assistant over at a lab over at the Yale School of Public Health. I guess it's interesting that we're talking about services today because a lot of times not a lot of people think that, research is service. A lot of times it's usually the opposite. But the reason why I think it's more of a service is because of the population that we serve. Just to give you guys as an overview of what the project is, we're called Movement, like the acronym MVMNT, which stands for Men's Voices in Mapping Neighborhoods and Technology. And pretty much what we do is we recruit participants within the LGBTQ plus community, and we do a computer-based assessment, incorporate technology. We also have an app that we download onto participants' phones to collect the geospatial location. And the whole idea is just to get a story behind these individuals and see, just to get a better understanding on the community that needs more resources, more services. We pretty much just kicked off the project right now, so we don't have any hard-hitting
Yes.
evidence right now, but right now, like, we have people who come into our office, do some assessments relating to their friend network, like the people that are meaningful to their life, the meaningful places, the stories that they go, like the places that they go to, their stories, as well as just their quality of life as well. And I guess pretty much with us, we ask a lot of questions.
Indeed. I've seen the questionnaire.
Yes, we ask a lot of questions, and I think that's the part that I wouldn't say throw people off, but I think it's interesting that when we ask so many questions, we want to understand,
Yes.
but someone can see asking a lot of questions as being too invasive,
Indeed.
so to speak. But essentially, we just want to get the stories behind the community so that way we can create more tailored interventions one day to help provide better
Yes.
services to the community.
Tremendous. And Lane, just before I come to you for Radio Lane and Whitney, unfortunately, people, they're parking, they're driving, they're at work. Their boss says, "Why are you listening to the show?" Or even if you listen on demand, sometimes the baby might be yelling. So if people want more information about how they can kind of find out about I'm going to mention that a few times throughout the show.
Yeah.
How can they be in touch or support or find resources, etc.?
And that is a very good question. So we have a website. I believe it's www.movementstudy.com. So that just gives you like a resource just to go online. We also have social media, Facebook. I believe it's movement.study on Facebook. And then we also have an Instagram page as well. But generally those are just posts to like bring awareness on like different observation health months, and also just putting in a little bit more information about our recruitment efforts, saying, hey, you might be interested in this study, reach out to us.
Tremendous. Tremendous.
Yeah, we have a couple other outlets too. Like if people are interested, they could give me a call at 203-974-9977. They can also text that number.
Good.
I'm a little biased. I'm part of the millennial generation, so texting is like perfect for me.
It works. It works.
It's that I'm just part of. I mean, I can pick up the phone and call, but
Yes.
I'm less nervous and panicky when it comes to text.
Lane, jump in, share. Because again, when Whitney mentioned that she wanted to kind of bring you onto the show, I was really pleased because it makes my job easier to have two people talk. You know what I mean? I can just listen and throw in a few jokes if I can find some. But your impact and your role with the organization, because the collaboration is so key, and actually the unity and the synthesis also.
Yeah, so I've actually just been there for a little over 2 years now.
At Anchor
Health Initiative.
Mhm.
My role there is transgender care case manager. So a little bit about what Anchor Health is. We are an LGBTQ primary care clinic. We're also a nonprofit. So we're actually pretty new. We were founded in 2016 by Dr. A.C. Demidant, who'd been working in LGBTQ medicine for many, many years, New York City, places in Connecticut, and just felt like there was still some stuff lacking from the way that we provide care to a population that's already marginalized. So she wanted to start her own clinic and do things differently. And even though we were just founded in 2016, we now have 2 offices. One is in Stamford, one is in Hamden.
Oh, okay.
We have over 1,200 patients now. 720 of them are trans, and I did not even know there were that many of us in the state of Connecticut.
So just on that point, you're suggesting that prior to the birth of your organization, there still were people out here that needed the services that didn't have.
Oh, absolutely. There still are. Absolutely. Yeah. There's a lot of medical distrust, specifically with the LGBTQ population, especially trans people in particular. A lot of medical providers, even if they're well-intentioned, just don't know how to provide the type of care that these populations need.
Yes.
And unfortunately, sometimes a lot of people are not willing to admit that they don't know something.
So the connection between your 2 organizations help our listeners to understand, because that's an important kind of link.
Yeah,
is what I'm sensing.
So pretty much with our study, we have a couple things that we need to get done, and one of them is an HIV testing. We do one before and 3 months after during their time during the study. Now, in some research, it's easy for a research assistant to do the test and be like, oh, you're HIV negative, you're all set. But one of the things that we do is we actually collaborate with Anchor Health Initiative and we cover for the cost of the HIV test and the STI test as well. But we also give participants the opportunity to ask about like medical questions, especially about PrEP. This is kind of a hot topic that's kind of came up in the community. PrEP is pretty much you can also chime in just to make sure, 'cause I am not a scientist when it comes to medicine, but essentially my understanding of PrEP is it's a daily medication that you take that helps you protect yourself from HIV.
Mhm.
So think of it as birth control. You take it every
Mhm.
day and it helps protect yourself. And we want to provide that opportunity for some of our participants in the study to at least be aware that this is a thing and if they need to get connected. Because that's, again, the topic is it's a very popular topic to talk about what it is, but we notice that a lot of people don't know where to get PrEP.
Mhm.
And I think
Okay.
that's where our link comes into play, where I refer people over to Anchor Health. So that way, not only do they get their HIV, STI testings covered, but the participants have an opportunity to talk to the providers about PrEP and get them connected that way.
So Elaine, in terms of the community caring and action, how do folks, because they may need your services, even if this particular project at your place of establishment was not even in operation, the need is still there. So how can
Right.
people reach out to you or your
Yeah.
organization
So
or more information or?
for sure, people can go on our website, anchorhealthinitiative.org, and you can actually request appointments and send us messages directly through the website. And it will also have our entire list of hours. And if somebody comes to us specifically for PrEP, because it's so important and is such a key to ending new HIV infections across the state, we'll get somebody in within 7 days if they want to go on PrEP.
Excellent.
So
Excellent. Some of the things we hope to cover, everybody that's listening over the next 35 or so minutes. And if we don't cover them, I might have to kind of just have you guys back. So that's a public invitation
Okay.
right now. We talked a little bit about the population that we're serving, and we want to elaborate on that a little bit more. And Lane, you've already indicated about the LGBTQ healthcare services and how that's kind of disparate, not really as effective as it should be. But also the thing about what do providers in the community need to know about trans people. That's something that is a topic, I think, that's a course, right? That's a seminar, that's a TV show, that's a movie.
right.
Mhm.
I mean,
That's a whole
and it's ongoing,
series.
and it's ongoing too. I think because people, even in my young age, I'm still somewhat ambivalent and not really sure about what this all means, because we all have our personal our personal histories and our personal predilections and our personal prejudices for that matter. And then, but how does this impact? Even like we had the thing his, her. Was it his?
Oh, the pronouns. So you got he, him, his, she, hers, hers.
And just as an aside, that's a new vernacular kind of category. But share with people, old people such as myself. Here I'm a little bit over 16. Well, there's an importance there, and it's 2 years old. 3. I mean, it's a relatively new demarcation of how we.
I think that in LGBTQ communities, we've been having the pronoun discussion for a long
Okay.
time now.
Yes.
I think that now, largely thanks to social media, it's becoming more popularized.
Okay.
So other people are asking the question
Good.
now.
Yes.
It felt like in the past, a lot of the burden on respecting pronouns, announcing pronouns, asking for pronouns was falling on people who are transgender because others didn't understand. And so it always comes, out of a place of respect. But it's really important to just ask everyone their pronouns all the time so that we're not singling out one particular person.
And as an aside, the Episcopal Church, as you may have seen, is just recently, they're going to kind of look at the Bible and delete God being a male. They're going to stop using the male pronoun for God. The Episcopal Church has kind of passed this. So it's gotten even into that vernacular.
Oh, yeah. Sure.
And what does sex positive healthcare look like? The challenges of your job, you've kind of alluded to that, but I really want to talk about that more. And the extent of the problem, I don't think people kind of understand the demographic shift that's occurring. And even the younger people, I mean, you have young people 5 or 6 years old, right, identifying themselves, and how do parents kind of deal with that situation, ways of engaging with the community. So just chip in. Let's hear some more about I can be more directive. The healthcare barriers, because I was, as I say, director of health and education for the Urban League back in the 70s, and then went to something called the Community Health Foundation 9-month fellowship on community health. And I mention that not to boast, but just even after my exposure to these areas, I'm still learning, and things are still, I'll admit it, still shocking me about what hasn't happened, or the problems that people are still encountering.
When you look into it, it does become very shocking. The most recent and most comprehensive study that looked at specifically trans healthcare in America was the 2015 National United States Trans Survey. And they found, according to that research, that nearly 1 in 5 trans people reported being outright refused medical care. So
Refused.
just refused outright. So that is somebody who goes to the ER for something and they just will not see them at all.
Say that again, because someone's going to
Yeah.
challenge you, and you've given information about how they can challenge you, but
Mhm.
this is in 2019. This is not 1860 or
Right.
or
No, this is
1730.
like I said, this is the most recent, most comprehensive study that looked at sort of the experiences trans Americans are still having. And yeah, nearly 1 in 5 reported just being outright refused care. A lot of the times that happens in emergency room situations. And nearly 1 in 5 also reported postponing getting medical care out of fear of discrimination.
Hmm.
So that's where the medical mistrust comes in as well. A lot of trans people that need health care will not go to the doctor because they are anticipating that discrimination happening. And even if it doesn't, the mere stress,
Just
sort
the
of,
mental stress.
yeah,
Yes.
it's the minority stress model, which
Mhm.
we've looked at for a long time, especially in communities of color as
Mhm.
well, where these cumulative things come together, and there are so many factors that somebody who is a marginalized population faces that the stress just comes out in every way in their life, including their physical health.
And Whitney, again, your project seems to me is it's kind of subtle in its intent, but
Mhm.
it really kind of captures some possibilities about structuring health prevention, or how can we, if not attack, improve the health service delivery system.
So so you're asking about the population
Well,
that we
or
serve.
just general your experience. It seems to me that we have a more specific, targeted project through the public health, and then we have a community service. But
Mhm.
there's that combination of research, identification, proactive identification,
Yeah.
as well as solution building and caring at the same time. That intersection is really impressive.
Yeah, no, I mean, with pretty much with our population, it's again part of the LGBTQ plus community. We specifically reach out to men who have sex with men, essentially,
Yes.
which I it depends on who you talk to. That might be a big shocker for some people, being
Mhm.
like, "Oh, wow!" Like, there's already a stigma when it comes to like
Yes.
saying that population.
Yes.
Because I'm also not only incorporating people from the LGBTQ. Wow, I need more coffee today.
Coffee's good. Caffeine is good.
Caffeine is great.
Caffeine is great.
Great. LGBTQ plus community. We also touch on a population where they may not identify as part of the LGBTQ plus community,
Yes.
but may have experiences that
Yes.
may be beneficial for our research. And I think I wouldn't say right now it's a challenge, because again, we recently just launched it. We've been getting feedback from people. We have been getting interest, but I kind of just wonder, like, are we reaching our population that we want to get more stories out
Yes.
of? That's always going to be a thing that comes up.
So let's make an appeal. If people have, let's make an appeal right now in terms of people might be listening to this, they might be in touch with folks that possibly might be interested in what you're involved with, might want to participate, might want to share the word.
Yeah. Oh, so pretty much make my shameless pitch.
Shameless or shameful or just prideful even.
Prideful. I like
Yeah,
prideful.
You like
Mhm.
prideful, all
Yeah.
right?
Yeah.
Apt.
So pretty much for our research project, we're looking for men between 18 to 29 who have sex with men. We originally started like around the New Haven area, but I think because we've gotten more support on our team, we're able to expand as far as Connecticut. So if someone's interested, they can contact us online. We have an email account, movementyalestudy@gmail.com. Facebook, they can even text and call the phone number 203-974-9977 just to get more information on it. And pretty much it's just starting the conversation. Like the way that I talk to people, I'm not like judgmental about like, oh, you did this thing. We're kind of just like, okay, fine. You did this thing, but we're just curious about your story and just kind of diving into that. And I think if people understood that I take a very objective approach, I'm
Yes.
not judgmental. I mean, in a genuine way, I don't care if you have sex with other men. That's not the point. The point is just getting more of the story. That's what I'm interested in.
And Lane, how do you respond to that in terms of once getting more of the story, what are the possible improvements, the possible solutions, the possible new strategies in terms of healthcare? What's it translate
Right.
for us a little bit?
And so I think that that's something that the movement study is able to contribute in an important way, that sort of to have LGBTQ informed healthcare, you need to meet the community where they're at. You can't just exist in that silo and expect people are going to find you and come to you and seek you out. A big part is seeing where that community is, where they're engaging with each other, where are they meeting people. And when you get to those stories, that's when you learn everything else that might actually be needed. I mean, you mentioned that anybody who does the study and comes to us for the testing, they also get the opportunity to establish primary care with us.
Yes, yes.
And a lot of people come for one thing in particular. You know, I have to get this HIV test, or I want a full STD screening. But then they get talking to one of our medical providers, and it's like, oh yeah, I've been neglecting this really important health issue for 5 years, and oh yeah, I've been getting migraines every day for the past 2 years. And if they hadn't come and made that point of contact with us via this route, I don't know that they would have sought us out.
See,
you know, so it's meeting them.
And say more about that, because again, as a transgender case manager, I mean, you see a lot of personal stories and issues, but say more about the attraction and again the impact and why this is important to you personally.
Right. Just from what we see, just trans people not getting health care, postponing medical care. From that same study I mentioned earlier, 50% of the survey respondents reported having to teach their medical provider about trans people. So even when they are getting that point of contact and getting into care, it sort of becomes a moment where they're on the spot and now they're teaching their medical provider instead of just being able to go and get the healthcare that they need. Or sometimes the healthcare that they don't think that they need, but they do, and they wouldn't otherwise know that or have that opportunity if there weren't people such as ourselves and many other wonderful people across the state meeting the communities where they're at. Like, we'll go to the gay bars. We were at Pride New Haven on Saturday. We go to community events. We link up with other organizations. It's really not enough to just sort of kick back and hope that people will find you. A lot of them do, but many of them don't.
And Whitney, I'm going to come back to you with the same question, but in terms of personally, I mean, you could be writing a book, you could be doing a movie, you could be skateboarding. I'm not sure what you like to do after the work, but the attraction for you and on the show, people are often every guest that I have has been so informative, but they talk about their purpose and their passion. And even their product, not that is commercial product, but the outcome of their existence. So I'm just to share a little. We're a very transparent show here. So kind of things that have driven you to kind of be involved with this. I mean, you could be doing other things 5 years from now, 10 years from now. Yes, I'll give you that opportunity.
Maybe.
But no, this is something that really has fulfilled you.
No, yeah, this is really what I'm passionate about. I really started getting involved with LGBT community organizing actually when I was 13 years old. When I joined GLSEN Connecticut and was the youngest board member to join that. And that's the Gay, Lesbian, Straight Education Network. And they're a national organization. They have a chapter in Connecticut, and that's what I was linked up with. And the goal there was to use education to make schools safer for LGBTQ students.
So wouldn't you give us a second? So, I mean, this 13?
Yeah.
Elaborate on that, because I mean, there's some because we have our show is shared with parents and grandparents, even young people listen. So this is key to me.
Yeah, no, there are a lot of ways for youth to get involved.
But you, how at 13 did you
it actually
know about it, even just and have the courage to get involved?
Right. The catalyst for me was actually when I was in 8th grade. That's when a boy named Lawrence King was murdered. And he was the boy who was 14 years old. He asked another boy to be his Valentine, and he killed him. And at that time, I was the same age. You know, I was around that same age, and in that community. And it was sort of a wake up call to realize that it's still the 21st century, but things are not always caught up. And I wasn't content to just sort of sit back and allow things like that to happen. There was a ton of bullying in my school, for example. So I really got involved with that. I learned about GLSEN, joined up with them.
GLSEN is an acronym for
the Gay, Lesbian, Straight Education Network. And through GLSEN, I was able to travel around the country, go to lots of trainings. They sent me to the White House once, which was really cool. And ever since then, I haven't really looked back.
Isn't that something?
Yeah, I've sort of made it my goal to be a professional queer, I call it, just working in the LGBTQ community full time since I graduated college.
Tremendous. I'm going to come back to that in a second. And when your public health, master's of public health from Southern, and you went to undergrad at Eastern, I believe?
Yes, my undergrad was over at Eastern Connecticut State University. I actually graduated with my bachelor's in psychology with a minor in public health.
Oh, okay.
Yeah, so I think what interested me in public health is taking a more like holistic approach and a more population approach because sure, I could be a psychiatrist looking at an individual concern, which is still interesting, but trying to see things in a population base, it's kind of mind-boggling to think that, oh, there are different health issues that go on that impact a community.
Yes.
And I think that's what triggered my interest. And after Eastern, I actually took a couple years before diving into a graduate program, and I did AmeriCorps for 2 years.
AmeriCorps, okay.
Yep. So my first year, I was with a group that focused on like going to community health centers, being stationed over there, and helping the organization fulfill their mission, especially reaching out to harder to reach populations.
Yes, yes, you indicated, yes.
Yeah.
Yes.
So that was my first year. I did that. And then my second year, I was with an organization that focused on like health education, providing resources to high school kids and college kids on like how to like get into the health profession while also giving them an opportunity to provide services for harder to reach population. So giving them resources, engaging with the community that is harder to reach.
So both of you, if there's a young person listening that's maybe 10th grade, 11th grade, 12th grade, 9th grade, in terms of career opportunities, it sounds so sometimes mundane and secular about, say, career opportunities, but self-fulfillment opportunities, self-satisfaction opportunities as they look at how they want to live their life. What would you say to them in terms of health profession? Is that something that could be attractive to some people?
Yeah, for sure. I actually never thought that I would end up in the healthcare field.
Okay.
I have no interest in being a medical provider. I do all the stuff that's not medical in terms of patient care, but I sort of found my way here just through a series of working at LGBTQ nonprofits. And then when this clinic was founded and I saw what they were doing, and just from my other work, I saw how healthcare was still failing so many people. When I had the opportunity to join in, I jumped at it. And I literally started when we were working out of a closet in the Department of Health, and we had one laptop that I used and an iPhone, and I answered all the patient phone calls on an iPhone. And I stuck with it, and now here I am 2 years later. We have this brand new amazing clinic, and I'm able to.
And the clinic is located where?
In Hamden, 2200 Whitney Avenue, and in Stamford, 30 Mayano Lane.
And people can reach out to you how?
They can either go to our website, anchorhealthinitiative.org. You can request an appointment right through the website. You can do the same thing on our Facebook, just Anchor Health Initiative on Facebook. Or if somebody just wants to pick up the phone and call, which we know many millennials don't, but they can, it's 203-903-8308.
Have any of you two, thanks for sharing, have any of you two been asked to kind of speak to it? My mind is so stuck on that 9th grade, 10th grade, even 8th grade, speak in schools or career days, or this is kind of an aside, but it just seems to me that it's so in terms of their education.
I've done it before when I was doing AmeriCorps, like part of like, in addition to our major task, our other tasks were to reach out to different schools around the area and talk to kids about like what are some things that they should do, why go into healthcare, and like what does service learning look like, which is essentially like providing services to harder to reach communities. Because we just noticed that a lot of kids aren't aware that these things are going on in their backyards, essentially. So I've had my fair share of doing presentations and being an advocate for healthcare, essentially.
Okay. Let's Whitney and Lane, let's give a shout out to some of your coworkers in terms of names and titles. And because again, when I see you, I see also behind you, I see your supervisor, your colleagues, and your coworkers, and even some community people that have helped you. So I'll start with you.
Yeah. So shout out to Trace Kershaw. He is pretty much. Think of him as like the boss's boss. He's the primary investigator of the study. He's pretty much the one that had this idea and was able to hire me, hire my other supervisor. Oh, I have two supervisors. That's right. I have two supervisors. This was also a recent change, and we're super happy just because we have more people on our team, more support. So the first supervisor I have is Erin McBurney. So she was the one who essentially interviewed me. She liked me enough and gave me the job, which I'm always thankful for.
Good. So the bribery worked then.
Yeah.
I see. Okay. All right.
And then we also have Cecil Tango Tanga. Shout out to them. They recently came on board onto our team and is doing a fantastic job. Just really like bringing out the community engagement that for me, like whenever I had the chance to do community engagement, it was great, but sometimes those opportunities were a little bit harder for me to grasp. And I think Cecil has been doing a fantastic job when it came to that. And pretty much our lab keeps growing because now we also have another research project on board too. Pretty much the project's called Renew. They focus on the similar method of taking an app and doing the geospatial location as well.
Okay.
But they focus on a different population that we could always talk about at another time.
And you will be you will be returning.
Yes, we will.
and Lane, just before I go to you, Whitney, the advancing relationships and community health. I mean, I like acronyms, I like names. Advancing relationships and community health. So that's Trace's baby, or you?
Essentially, Trace's baby.
But share about the connotation and why he chose those words to kind of.
That's a Trace question.
So, but I mean, it's typically to give him a structure where he can engage and we can develop and explore from a public health standpoint. What is this? What do these words mean? But also for not just for a paper in an academic journal, but also for community benefit.
True. So the thing about Arch, what I really, really like about it, I mean, again, I feel like Trace would be the better person to explain more.
We will get him to Zoom in or something. We'll work on it.
Yes, we will work on that. But essentially what I like about Arch is that we take a community-based approach. So I see a lot of research projects that go on, they're like, hey, we're doing this drinking study. I don't mean to shout out to a different project, but we're doing this drinking study, but we have a hard time like recruiting people for the study. What's going on? But then little do we know they're not going where the community is. They don't have a full understanding of what the population is. And they have like policies and structures that they can't really be flexible about. So like another example is that when it comes to like when we provide compensation for participants, if there's like a little situation that, let's just say like, oh, they didn't do this assessment, but does that mean we just take away part of their compensation? Which obviously the answer is no, because we understand that that's kind of an important part in people's lives, and we want to take that seriously. We don't want to be like, well, because you didn't do that assessment, we're taking away money or not giving you resources that you need. So we take a little bit more time to really understand some of the people that come into our office. So like, for instance, there's been the topic of like finding housing that kind of came up. Again, it's not like a big research discovery that we're coming across, but some case by case, we're noticing, oh, people are having a hard time getting housing. People are transitioning over to different houses. Like, is there something that we can do about that? And I don't think a lot of research projects focus on, okay, so who's coming through our door? What's that story?
Yes, this is so much in terms of the community caring and action, where I guess through you two would kind of be able to hit that point home.
Yeah.
Let's give a shout out to some of your tribe and your coworkers and your other village participants.
Oh, there's so many people now.
Well,
I love everyone I work with.
And that's the thing. Just a name drop. I mean, feel free to give as many names as you want, because the purpose of the show is for people to see that we are connected, whether we want to admit it or not. Right. And we're connected either positively or negatively. So let's make it more positive than
right. So clearly our founder, Dr. AC Demadon, who's also the one that snatched me up and was sort of like, you're going to work here. Yes. I said, okay. Yes. And it worked, because again, 2 years later, I'm still here. She's just amazing. She does so much for the trans community across Connecticut, not just in terms of medical care and then HIV prevention and HIV care. All the medical providers we have now are amazing. We have Patty Alfieri and Sharon Sutton as our APRNs. We just hired another RN, Chris Adams. I work every day with a really close team. Tanya Nunn always helps me with insurance navigation, because again, we don't just stop the buck with something like healthcare.
Yes, please.
My coworker Richard Rippey, the MA, Abby, our MA, our amazing front desk staff, Ava and Michael. We just have, like I said, we're growing. We have a ton of people, and we all have a very specific role, so that somebody never really reaches the end of their resources with us.
Perfect.
I do what I do, and if they need something more, I know that I have somebody that I can go to.
We're going to kind of conclude with kind of walking, both Whitney and Lane, you're walking our listeners and our audience through your not really typical day, because I imagine every day has pleasant surprises and pleasant challenges, and I appreciate you even being willing to do that. But just before we go to that kind of closing question, share Whitney and Lane, terms of the community organizations that you're working with, community organizations that have been helpful, community organizations that you want to, well, I won't say that don't want them to be more helpful, but once you've established an alliance with,
Yes.
and because we all, for any of these, any problem, you name a problem, whether it's any problem, housing, education, employment, there are various levels of impact on people moving up that ladder.
Mm-hmm.
So you're a tremendous person. You're a tremendous person. I'm of course a tremendous person.
Yes.
You know that, but we can't do it alone.
Mm-hmm.
So allies and our community relationships are so, and liaisons are so important. So let's name drop a little bit, and then you'll walk us through your day in conclusion.
Sure. So some of the organizations, other than Anchor Health Initiative,
Which is number one, of course.
Yes.
Clearly.
I believe when we started off, they were the first organization that we pitched out, and
Excellent.
they said, yes, how can we help? So big shout out to them. APNH, they were formerly called AIDS Project New Haven, but they're now called A Place to Nourish Your Health.
Okay.
They've been big advocates in the community for as long as I've been around. And they have a lot of comprehensive resources that are more like general stuff. So they have information on health, but they also have like well-being as well. That's really good. New Haven Pride Center, obviously, they've been around for a long time as well. And they've been a big help in like really understanding the community. Especially I've noticed more for like youth, which is really nice.
Sure.
And they have a lot of like events that they do relating to like arts and getting connected to the community that way. So they've been a very big help as well. Trying to think.
I know you've worked with the USEF at the community at the Cornell Scott. Have you?
Oh yeah, like we've touched base with them. Like we've had conversations. I've gone to meetings with them, but I think that's a really great opportunity to build up on it. We just got to make sure on our end, like, do we have what we need to provide them some stuff, and vice versa. So it's a working progress, but I think it's definitely a very great opportunity to get connected with them.
Okay, Lane.
You named all the ones I was going to name. No,
Well,
but really,
but it's important to mention those names because again, they're helpful to you. They're helpful to you, and so just that intersectionality.
Right.
You hear that term
They're doing
so often,
something right.
But they're doing, but people are realizing our co-interest, our mutual interest.
Right. Yeah. APNH has been a great resource. We work really closely with them because, like I was saying, meeting the community where they're at, that's a huge part of what they do. They have a group as part of APNH called Empowerment, and it's a group specifically for young men who have sex with men and allies to them. So they're always doing a ton of events. They just had a great barbecue a few weeks ago with hundreds of people attending, and we were there. So that was really great to see. The New Haven Pride Center also providing resources, and we've done a bunch of health and wellness programming there, and we will continue to do more. So it's always a community space for us. And then nationally, but also down to the local level, there's an amazing organization called Trans Lifeline.
Trans Lifeline.
Trans Lifeline. A lot of people think that it's just a sort of crisis hotline for trans people, but they actually provide direct resources, and they operate 24/7. They always have a trans person on the other end of the phone when you call. So even if you call and you said, hey, I want to legally change my name and I don't know where to begin, they'll help you walk through that. They'll give you medical referrals, or it can just be, like I said, a crisis hotline. So they're an amazing resource.
Right. So before we go into your closing remarks about walking us through your day, and really appreciate people you're sharing that so people can visualize that we all are on our particular journeys, but even just to vicariously experience your journey, I think is illuminating. Can bring some life, and also help you with everyone's daily tactics and strategies about how they interact with people. They may see people in the supermarket, in the car wash, at the car repair. Just being respectful and having more of a day to, because we have a lot of like common coffee shop conversations and casual conversations. But sometimes in those casual conversations, you can really you might be able even to tune in to how you can be a helping servant to someone, even unbeknownst to you, but that you just might encounter in your daily walk. So let's as the time is kind of winding down, walk us through your last day. I mean, not your last day, but your daily walking, and you can kind of embellish it. I know you go to Cancun sometimes, you go to St. Martin sometime, and I know you go to Provincetown sometime. I know I'm just making a joke. I know you've been there, but help people to understand that your journey, your walk, your dedication is not kind of haphazard, not haphazard at all.
Yeah. So I mean, again, we've touched base on like public health and why that to me is a passion of mine. And I think it really does tie in what I do, because I'm not, as a research assistant, I'm not just going in and just collecting information. Like I have interpersonal conversations with them just to get them comfortable. But also like make them be aware that I am genuinely interested in their lives, and I'm not just some research assistant just collecting numbers. And
So
data.
today you might be talking to a potential client.
Yeah.
But then will you have any meetings or?
I mean, sometimes we have meetings. Like my schedule just goes all
So
over the
give,
place.
give us an
sometimes.
idea. I know it goes to St. Martin and Cancun.
Yeah.
But
Those are during my
but
breaks.
those are
though.
your breaks.
Those
Good.
are during my
During
breaks. But essentially, we'll have meetings just talking about like what are we noticing during the visits? How
Yes.
can we improve our surveys?
And you have a group out of, was it Alabama or
Oh yes, we
Mississippi,
have our sister site. I can't believe I need a shout out to them because they are amazing too. So part of our study, we collaborate with the University of Georgia team.
Mhm.
And that's a shout out to Sally, who's all the way down over in Georgia,
Yes.
who's pretty much Erin's position. Like
Okay.
she oversees that project and makes sure that things are running smoothly. But pretty much we are replicating our project from up here over in Georgia to see if there's any community differences between the two.
And also there's that cross fertilization, I would imagine, among the two as well.
Yeah.
Okay.
Yeah.
And walk us through a little bit today. What was cooking? I mean, I know you're
Right.
going to St. Martin and
Oh, of course.
Cancun and.
I never know what my day is going to look like. It really depends on the things that happen.
That's the mystery of life, right?
No,
but,
it's great.
But the point is, you're involved with so much of that
Mhm.
life, and then how life unfolds.
Right, and that's how it happens because, I mean, the typical day we'll have a full schedule of patients and they'll come in. And then one of the providers will come and get me and say, hey, Lane, can you go in the room with so-and-so and talk to them about this? Because it'll
Yes.
be something that they need that's not medical
Mm-hmm.
specifically. Maybe it's like they have questions about how to change their gender marker on their birth certificate. Can you go in and do all of that? So I'll do that. Somebody comes in, a new person wants to get on PrEP. I'll go in and sit with them, talk to them about PrEP, see what they need, sign them up for copay support, do insurance navigation, provide assistance that way. Reaching out to a lot of people. If somebody fell out of care, I try to get in touch with them and see if I can find a way to get them back into care.
Good,
A lot of
good.
reaching out.
Good. Yeah, we have roughly 90 seconds, not 90 minutes, but 90 seconds. Just lastly, talk about or share the numbers again. You mentioned the 1 in 5. Whether, from my standpoint, even if there was just one, this is really facetious what I'm about to say, but if there was just one transgender person on the planet, that person still needs full and equal whatever.
Right.
But there's more than one.
Oh yeah, yeah. Like I said, we already have over 720 trans patients just at our organization with just 2 offices.
Yes.
And it's important because, as I said earlier, recent studies found that nearly 1 in 5 trans Americans reported being outright refused medical care due to their gender. Nearly 1 in 5 reported postponing needed medical care for fear of that discrimination. And 50% reported having to teach their medical providers about what it is to be trans.
And Whitney?
Oh, regarding the numbers?
Well, just the need. This is not just an incidental, as I say, even if there was just one person that was not receiving full and equal treatment as a citizen of the planet, we'd want to abolish whatever oppressive systemic methods or powers are keeping that person down. But this is important in terms of a demographic, in terms of a public health issue.
Yeah, so with the population I serve for men who have sex with men, I think it shouldn't be a surprising thing, but it sounds like the issues that come up are very like general and they're very similar to what are some things that we come across ourselves, like housing. That's been a pretty big topic that I've come across with some people. Mental health, obviously, that's a
so the whole combination of things.
yeah.
Great. Well, we can see Harry's given us the
I know.
key,
I'll end on that.
which he has to do. That's what the general manager, Harry. Thank you. But you guys have already promised to come back.
Yes.
Yeah.
You promised to come back.
Of
People
course.
can
Go have
reach
me.
you how?
You can go to our Facebook, Anchor Health Initiative, our website, anchorhealthinitiative.org. Send us an email at info@anchorhealthinitiative.org or call us at 203-903-8308.
Whitney?
And they can visit our website at www.mvmntstudy.com. They can also text or call me at 203-974-9977. And we also have social media as well. If you do movement study, you'll be able to find us.
Perfect. People, thank you.
Thank you.
Thank you so much for
This
having
is a lot
us.
of fun.
Yeah, we'll do it
thank
again.
you.
Of course.
You'll get my bill. Don't worry about it. Thank you.
Thank you.
All right.
Face them storms, now you gon' face the dawn you waiting for. I said from night to dawn, I right my wrongs alone. In competition with warnings, ice galore. Now I'm running toward it, my life to finish being a quitter, but little by little they joking, telling some riddles.